Um, Welcome everyone to the Coffee and Quality case study presentation. This is our sixth case study, and we're really excited to dive in with Prevent Blindness Texas and the Kinder Institute for Urban Research to really find out some great findings. So, let's go back. Sorry about that. All right, guys, as always with Coffee and Quality, we do have some ground rules. There will be time for question and answer at the end, so we encourage you to express those, come off mute when it's time, write your questions in the chat. We will hold on to those. We do want you to be participants in this, as this is a safe place to share and learn, and we're really excited for you guys to be here. Quick commercial. Of course, if you are not on our team's channel yet, we encourage you to join us. It's a wonderful space where we share opportunities, insights, materials, and just build community. So if you are interested in joining our team's channel and are not already a member of Coffee and Quality teams, just put your email in the chat and we will make sure at the end of this meeting that you get added to the list. Thanks, guys. All right, so why are we here? The case study is one component of Coffee and Quality, and it's this really amazing opportunity that we have to dive deep with one nonprofit institution. In combination with the United Way of Greater Houston and the Kinder Institute for Urban Research, we have had the joy and pleasure of having 5 organizations previously go through this process, and you can see them here labeled here today, and I know some of them are here in this presentation, which is always really nice to see them coming back to hear what other organizations have to say. This is an opportunity for us to really dive deep, to use the nonprofit's own data to dive deeply into a research question that they wouldn't have the capacity or ability to answer on their own due to a variety of restrictions. So it's a really wonderful opportunity to get insight in that nonprofit. So what does it look like? The United Way of Greater Houston works to identify a nonprofit. We prepare them, understand what this process is going to look like. Then we bring together the Kinder Institute for Urban Research, the United Way of Greater Houston, and that nonprofit for a kickoff meeting, a time to just discuss, figure out, discussion of possibility, what this might look like, and get to know each other. Then kind of comes the really vulnerable part where the nonprofit shares their data, and we kind of get to dig in and look for those research questions on what the data insights can we gain from their data. All along that path, we are meeting to ensure that we're aligned, we answer questions, make sure everybody is on the same page as we continue to learn and grow. And then what we're doing here today is sharing that out with the greater Coffee and Quality community, because while the insights are wonderful for the individual nonprofit, we really want to share that widely with our greater nonprofit community so that we can all learn the lessons and frankly just nerd out about the data as well. After this, we'll continue to process the findings, and the Kinder Institute will produce this beautiful research brief that we will again share out widely with our community. So without further ado, this case study number 6, takes us into Prevent Blindness-Texas as our nonprofit that we're focusing on. So I'm going to hand it off to Heather with Prevent Blindness-Texas to tell us all about their amazing organization. Heather?
Thanks, Allison. All right. First of all, I'm Heather Patrick. I am the CEO of Prevent Blindness-Texas. I've been there for almost 9 years, and we serve the entire state. Which makes, I think, this case study a little bit interesting, and we'll talk about that. But I want to say this process for us has been truly amazing. And thank you to both Kinder and United Way, because it has been super helpful for us, especially as we've been in our strategic planning process. So thank you very much. Next slide. So just a little bit about us. We've been in the state for a long time, 70 years. And really, we're one of, I think, the only groups dedicated to prevention around vision loss. And our mission is to prevent blindness and preserve sight. Really, for us, though, the ultimate goal is to make that connection between eye health and overall health, and why it's so important to understand how your vision plays a part in overall health. In the last 2 years, we've served over 120,000 individuals across the state. And we really do provide, from start to finish along the continuum of care. We really decide what we're going to bring to the table, community by community. Next slide. Yep. So our current strategic goals are, as I said, preservation of sight, prevention of vision loss, to elevate eye health as a critical component of overall health conversations, for us to be recognized as a thought leader, a convener, a change agent in the eye health space, and for us to be an advocate for eye health and overall health. And we do this work in three main buckets, basically awareness, access, and advocacy. Next slide. So, as I said, we do a number of things, but basically, when you break it down, we identify risk, and we do that by vision screening. We educate on all different topics related to vision and vision health and vision loss and how to prevent it and what to do if you're experiencing vision loss. We train across the state for both people to become children's screeners and adult screeners. In the state of Texas, children's screening is mandated. And in order to provide that screening, you have to be trained and certified, and we do that. And we navigate clients across the state to different resources. We also provide financial resources, and we just walk with them along the way to get the care they need. Next slide. So, in strategic planning for us, we start with the theory of change. Really, truly, what are we trying to change in this space, and how are we going to do that? What are the problems we're trying to solve? Who do we need to work with? Who do we need to influence? What are the resources we need to do that? And what's the current environment? And we make a couple of assumptions of what's going to work in that environment, but this starts it off for us. And so, as I said, we're just wrapping up our new strategic plan. And so we basically have a guiding statement for us. And this is the guiding statement in our new theory of change. We're committed to designing innovative and integrative vision care systems to advance the well-being and quality of life for children, adults, and seniors. And really, it's about creating strategic partnerships, which I will say, and I don't know that we included it in our key takeaways, but I will say one of the key takeaways as we were learning about the results of the data, we talk about how important partners are for us. And that is, we couldn't do what we do without our partners. But the number of partners that were presented was just, I think, really overwhelming for Monica and I. You just don't realize, because you're in the day-to-day, your impact and the extent of those relationships. And so that was really exciting. But for us, it really is about collaboration, strategic partnership, and how do we build the right systems to move people and keep people in the continuum to get the care they need. Next slide. So for us, the issues we're trying to solve, basically the lack of integration of vision care and eye health into the broader healthcare landscape, the lack of funding and investment in eye health solutions across the state and really across the nation. But right now is a key time. If we have the ability to truly change the path for vision health, but it takes a significant investment right now. Otherwise, if we don't, it will be an epidemic within the next 25 years. The amount, the percentage of vision loss will increase dramatically without significant intervention right now. And then, the fragmented patient journey, we really want to change that for our clients. We want it to be as cohesive as it can possibly be for them. So, again, our area of focus, awareness and education, access and care coordination, and advocacy and creating, we call it a hub, but really it's a coordinated effort across the state to leverage our partners and stakeholders in really building a comprehensive and strategic eye care, healthcare vision plan for the state of Texas. And then we are happy to talk about partnership. And if you have any questions, please don't hesitate to reach out to myself or Monica, who's my VP of programs.
I'm going to hand it off to the Kinder team now.
Awesome. So thank you so much for that, Allison. Very much appreciate this opportunity to be able to share out our results with everybody. With that, let's get going. So this is our sixth case study here with Coffee and Quality. And so just as a quick background, next slide, please. Uh, for our presentation today, what we will be talking through are a quick overview of what the goals are when we set out on these case studies. And I know Jessica's already touched on these things, and so we'll make that quick and just wanted to refresh everyone's mind on what that is. And then we will also go through the process that we follow as part of this. That'll help us to get into the research questions that came out of that process. We'll get into some of our analysis and then we will share some results as well. And then we'll turn it back over for a discussion of observations here. So first off, when we think about the goals of our case study, what we are talking about here is wanting to utilize data that we're collecting from a nonprofit, specifically in this case, Prevent Blindness-Texas, in order to understand the clients that they're serving. And one of the unique things about this case study relative to the former ones that we've been doing here is this was the first time for us to work with a nonprofit where that nonprofit is situated around the entire state and that we were working with data from around the entire state. And so one of the things we set out on here with PBT was to understand the areas in which their clients are living and where they are concentrated. Heather mentioned earlier all of those partner agencies they're working with, where their screening was taking place. And so looking to see where are screeners located, how far are clients traveling, and then what are some of the services that might be available to clients that are already being served. And so these were the goals that we wanted to work with specifically for PBT. And then our second goal of these case studies is having to do with this broader sort of nonprofit system here, the nonprofit community that exists. What are some ideas, some learnings, some understandings that emerge out of the case study for us to be able to take? And yes, it is applicable for PBT, but really that is a lesson, that is an understanding, that's a learning that we can expand beyond. And so these are our two shared goals. So the process that we use is we go through what we talk about as a partnership model. Within that partnership model, our goal is not over here at Rice to come up with ideas that we think would be interesting to study, but rather really get into this space of co-creation, co-designing, and co-development. And so we met with PBT and United Way, sat down to talk together about, again, like what are the goals? What are the interests? What are the things that people want to learn out of this case study experience? And through that process, developed ideas, developed some research agendas, parameters, and then used that in the co-design and co-creation of research questions. From there, we got into that space of data sharing, as was mentioned earlier, that vulnerability, and it really is a vulnerable moment. We totally understand that. And we very much appreciate people's willingness to trust us in that vulnerable moment to be able to share that data with us so that that initial investigation can get underway. You know, sometimes we start out with lots of ideas and this initial investigation helps us to narrow it in. Sometimes we're really focused on ideas and that initial investigation helps us to refine it in that moment. But we go through that preliminary investigation so that we can continue to refine the research plan. And again, all of this being done in a partnership model of co-creation, co-design, and co-development. Once we have refined the research plan and we've begun to focus on what it is we want to do, that data processing and analysis kicks up to a kind of a whole new gear. Again, throughout the process, we have ongoing communication. Nothing we are going to share today. Again, you know, while this is a share out and it's new to the folks who are seeing this as part of the Coffee and Quality quarterly session here, this is not a new thing for our, the partners involved in this process. And because we have ongoing communication, we have ongoing share outs, making sure that any information we're sharing out has been talked about, discussed with, and run by the partner. That helps us to make sure that we're getting an understanding about what we're seeing. And if ultimately something's not quite looking right within our analysis, we have a chance to revise it. And so through that process, we do arrive at today, this moment of dissemination. So let's get to the findings. So in order to get into the findings, let's first start with outlining our 3 research questions for this case study. Our first research question that we're going to look at is, what is the average distance clients travel for a screening? The second one is going to look at how many follow-up providers do clients have within 2, 5, and 10 miles of where they are living. So again, if we think about PBT as this initial screener, these providers are that follow-up service that they're looking to try to connect individuals into. And then finally, are there any potential providers that already have a large number of clients living nearby? These are going to be the 3 research questions guiding today's presentation. So with regards to the analysis plan, in addition to this being the first time that we have done a case study that was working with a nonprofit's data from around the state of Texas, this was also the first time that we have engaged in what is referred to as geospatial analysis for purposes of the case study. And so we are going to do geospatial analysis of PPT data. I'm going to allow some of my colleagues to talk a little bit more about that here in a moment when they present some of the findings here. In brief, what this means is we're going to geocode addresses of the clients that we've got from PPT, and then we're going to use geospatial calculations to look at things like distance to generate counts of licensed optometrists within a 2, 5, and 10-mile radius, and then ultimately do something similar to look at how clients are nearby optometrists. So looking at the data that we got from PPT, we got data from over 8,230 clients. These were clients that had been served by PBT between 2023 and 2025. And we broke these out into 3 regions, reflecting the regions that PBT talks about when they are looking at their own service and providers. And those regions are the North, the Southeast, and the Southwest. 15% of these client entries came from the North, 57% from the Southeast, and 28% from the Southwest. Turning now to look at the partner agencies that we had. When we looked at all of the data that was provided, we saw that there were 146 unique partner agencies in the database working with adults being served by PBT. Again, if we look at the breakdown here of where those agencies were located, we see 20% in the North Texas space, 51% in the Southeast Texas space, and then 29% in the Southwest Texas space. Very much sort of having this moment where we are recognizing the overlap between where are the clients and where are the agencies where clients are getting served. And so that is a little bit of background about where our about the data that we received and the information contained in that data. And so now let's turn to investigate the first research question. And for that, I want to hand it over to my colleague, Eric Hill. Eric?
Yeah, thank you, Daniel. So one question, like he said, that we're interested in, we were trying to figure out some notion of how far people were traveling to get to the screening so we can determine how geography plays a role in how people are able to access screening. And so the first thing we needed to do is we needed to do what's called geocoding of the data. So whenever clients came through a screener, they'd fill an intake form. And as part of that, they'd put down their address, and there'd be an address for the screener location they went to. And so we could take all those addresses and we could just figure out the latitude and longitude of each of those addresses. So we're able to find the spatial locations of each of the clients and then the screener locations that they went to as they came through the screening services. And so we were able to find the locations of about 90% of the clients and 95% of the partner agencies. And so there were a couple agencies and clients where we weren't able to figure out the address, and we really didn't want to work with data that we weren't confident was accurate. So when there were cases of ambiguity, those were cases where we didn't end up geocoding those addresses that we could be confident about our findings. And so when we were trying to figure out how far people are traveling, what we did is we took those coordinates that we had geocoded and we just calculated the straight line distance between each client and the screening location that they got their screening at, using just straight line as the crow flies distance. And so once we had how far each client was traveling, then we could do statistics on that. And so we were interested in how far each people are traveling. And then we were also really curious how this might vary by screener and by zip code. So we can get some notion of how the geography might add to challenges in different areas. And so what we found overall for the entire state is that 20% of clients traveled less than 2 miles to get to their screening location. A lot of this we found was from either mobile screeners or screeners that also served as housing. So then people were able to get there in a very short amount of distance. And then we also found that 37% traveled less than 5 miles, 52% traveled less than 10 miles, and there were 29% who had to travel more than 20 miles. And then looking at how that broke down by region and by zip code, here's a list of them. So we found that American Legion Odessa, people were traveling an average of 69 miles. At San Jose Clinic Midtown is 44. Ventela de Salud Eagle Pass 346. And you can kind of get an idea here of how they vary across all these different screeners. And then this is looking at the same thing. So this is looking specifically at different zip codes and looking at how far people traveled so we can get an idea of where regions where there might be additional challenges posed by geography, or maybe that they're doing very well on the issue. So we found, for example, that in Dallas, in zip code 75253, people are traveling 84 miles. Zip code 78544, which is in Roma, Texas, people are traveling around 85 miles. And in 78227 in San Antonio, people are traveling around 85 miles as well. Okay, and so just like a summary of our results, we found that often clients were traveling relatively short distances, so half or less than 10 miles. But there were definitely cases where if we looked at the zip codes where people traveling the most overall, if we looked at the screeners where people were traveling the most, there were definitely cases where people had to travel a much longer distance. And those are cases where it seems like that might provide more of a challenge for them. And in general, we also found the same thing for zip codes. So there's definitely cases where people had to travel a longer distance.
Yeah. Thank you, Eric. So from there, we wanted to continue our geospatial analysis by looking at specifically how many follow-up providers clients had within 2 miles, 5 miles, and 10 miles of where they live. So think if you're a client wanting to seek care, where is the nearest provider? And if we go into the next slide, we can see our analysis plan. It was very similar to the first research question, but in this part of the research proposal, we looked specifically at licensed optometrist data that we obtained from the Texas Optometry Board, and we were able to get the address from all of these different optometrists in Texas. From there, we calculated the number of licensed optometrists that are within 2, 5, and 10 miles of where the clients lived using the previously geocoded client data that Eric mentioned. And from there, using ArcGIS, we were just able to figure out, for example, if I plop a client point right here, here are the number of provider points that are within that radius. And we were able to calculate the average number of providers at each level, so 2, 5, and 10, living within a zip code to identify zip codes of hotspots and zip codes where there was less provider density. And we were also able to look at that within the region as a whole. So very similar analysis plan. We had 90% of client addresses that were able to be geocoded, which was super great, really clean data from the PBT team over there. And then we were also able to look at the 5,000 licensed optometrists around the state, and about 65% had sufficient address information to be geocoded. And again, as before, we don't want to use client data, or we don't want to use data that we're not confident in. So using the 3,311 optometrist providers that we were able to identify, that's how we did most of our analysis to maintain the most number of cases possible. So after geocoding all of that, we found first that there's 313 zip codes across Texas with more than 5 clients served by PBT. So we have a huge reach across Texas. And when we break it down to the provider level, we have five is the average number of providers within 2 miles of where each client lives. And then we have 30 as the average number of providers within 5 miles of where a client lives, and up to 105, which is the number of providers within 10 miles of where each client lives. But obviously, Texas is a super big state. We have huge variances across different zip codes. So we wanted to make it more granular. And we looked at the regions broken down, as Eric said earlier, and we looked at specific zip codes. So, for example, in North Texas, we had a bunch of zip codes with 10 or more service providers within 2 miles. And these are concentrated in big cities. So think Dallas, Fort Worth were the main areas where we had a lot of provider density near these clients. But then we also see places where there's lower provider density. So in places like Mesquite, Jarrell, and Denton, as well as some zip codes within the Dallas and Fort Worth region, there were some zip codes that had one or fewer service providers within 2 miles of where a client lived. And we can also look similarly at Southeast Texas. As expected, in Southeast Texas, we have Houston, Texas. Obviously, there's going to be a lot of density, especially within urban Houston. So all of the zip codes within Southeast Texas that had 20 or more service providers within 2 miles are concentrated within Houston. But then again, we have these service deserts, as mentioned in the chat, where there are zero service providers within 2 miles. So that occurs in places like Conroe, Hitchcock, Needville, etc., places that are less urban hubs within this service region. And we can also look at Southwest Texas. So again, we see huge concentrations in places like San Antonio and Austin, where when all the concentrations of these zip codes have 20 or more service providers within 2 miles. But then we look again at these service deserts, which occur mostly in smaller cities. So for example, in places like Comper or Ingram, Texas, we have zero service providers within 2 miles. So overall, when we look to summarize the second research question, we see that PBT serves clients across the state. We have over 300 zip codes where more than 5 clients live, so a lot of impact there. And on average, when we're looking at all of Texas, clients have about service providers within 2 miles, 30 service providers within 5 miles of where they live, and 105 service providers within 10 miles where they live. And we can also see that this is really dispersed across zip codes as well. So access to service providers varies significantly across the different regions, and many zip codes also have no service providers within 2 miles. So with that being said, after we did this analysis, we also wanted to see where there were opportunities for PPT to grow. And that's where we brought in the third research question. So are there any potential providers with a large number of clients living nearby? And we had very similar analysis plan building off of research question two, looking at optometrist data from the optometry board and the exact same process of using these spatial joins in order to analyze how many clients live within proximity to an optometrist. And if we break down the service providers, so for example, looking at North Texas, we see a huge density of service providers with more than 40 clients living within 2 miles. So these are super high impact service providers, and these also provide opportunities for PBT to look at avenues of expansion, telling these providers, hey, these are clients that are able to be serviced by you, and being able to kind of expand their mission in that way. And so we see these concentrated primarily within Fort Worth, again, as you think big city, but as we saw before, there are places and zip codes even within Fort Worth that have huge service deserts. So this is really useful information there. And if we look at Southeast Texas, we see that there's an even larger client density. So there are service providers with more than 250 clients living within just 2 miles of where they are. And these are primarily concentrated within Houston, where we have, for example, multiple service providers within one address, so large clinics as well. And if we go to look at Southwest Texas in the next slide, we can see that there are service providers with more than 50 clients living within 2 miles, and these are concentrated in the following two addresses as well. So if we go to summarize research question three, we see that there are a lot of new potential partnerships that exist around the state to where PBT clients are already living. So think we have 250 clients that are within these licensed providers within just 2 miles of them. So these are exactly like really true and prevalent within the Southeast Texas region. And they also present new opportunities of growth and expansion with providers around the state to really be able to cement PBT's mission of preventing blindness in the future. So now I'm going to pass it off to the PBT team to go into takeaways.
Next slide. So, through our experience, one of the things that we learned was that reliable data doesn't happen by accident. It actually happens because of a lot of work that's put into the process. And so for us, one of our key takeaways was really understanding the importance of a documented process in order to ensure data integrity. This experience also highlighted, the process that, we're encouraged to rethink about how we currently collect our data in collaboration, not just with our team, but also in collaboration with our partners and our providers, especially because our work is ongoing. So this process really helped us to rethink the way we're collecting our data. This experience also helped us to really understand the importance of investing in data collection and management to help us advance our mission in our organization. So building, this organizational strength of our data is highly important. And it's a story that we can tell, but we have to learn how to be able to tell the story a lot better through our data and our numbers. And also the need for consistent data across, the way we are collecting it to help us improve our accuracy, consistency, and also our reporting. So we also learned that, the consistency and accuracy is a truly important part of how we collect the data. And then, we're doing this work every day. And so for us to be able not to just get stuck on how we're currently doing it, but to continue improving our process is also really important. So as we are about to finalize our strategic planning that starts our new fiscal year on April 1st. This is going to become even more important because we want to keep evolving. And so as we evolve, so does our data. And we're hoping that our processes and how we collect the data and how we tell the story continues to improve. And we want to keep evolving whatever, those current needs are in order to make our organizational strength just even stronger. So these are our big key takeaways and recommendations. And once again, if you would like to connect with us, the QR code is on the screen. So please feel free to visit our website, preventblindnesstexas.org. You may contact Heather or myself. We encourage you to visit our website, learn more about our programs. There's a wealth of information on eye health and safety. Or even if you just want to have a conversation with us about who we are, what we do, we're always open to that. And then we always like to encourage you to check out our social media pages. There's a lot of great work that we're doing in the community. I always tell our volunteers it's great to be able to put a visual image to the work that we're doing in our community outreach. So we are on Instagram, Facebook, X. So please feel free to connect with us and shoot us an email.
Thank you. Thank you so much, Monica. Let's give Monica, Heather, the team from Kinder Institute, Claire and Eric and Dan, a big round of applause. Really appreciate them walking us through what they learned, the takeaways, all the amazing insights from their case study experience. Let's transition a little bit into recommendations for all nonprofits. Hopefully, as you were hearing what they were sharing, there's things that are like top of mind for you, things that are coming up from you. And so let's start on the next slide and kind of really start with it's all about the people. And that really stands out when we think of continuous quality improvement. And so that is the systematic use of data to improve the effectiveness of programs and services and communicate their value. And that doesn't happen in a silo. That doesn't happen by just one person. It takes a whole organization. It takes everyone committed. In this case study, we got the opportunity to go in and do a presentation, a training with the whole Prevent Blindness team. And it was really great to meet with them. They are small but mighty. To know that 9 people serve the whole state of Texas for this, just, I mean, another round of applause for that, right? Like, wow, what you're able to do, what you're able to accomplish with your organization is just incredible. And it really does, for me, underline the importance of this like human driven cyclical process. Like it takes everyone, it takes the people in the organization, not just technology tools. And so I mean, like we think of this human driven process, right? Like do the work, collect the data, review the data, think of recommendations, think of ways you can improve, implement that and keep it going, right? Like this isn't one and done, it's not a checklist, but I want to zoom into data collection. And so data collection is something that we spend a lot of time on. We spend a lot of consideration in and what really like works well for your clients and the work you're doing. I often think about what's the opportunity cost that we're taking when we ask somebody for information, whether it's in an intake form, an assessment, a post survey, a feedback form, just watching them do something. Like what's the cost on that? And how are we doing that in a way that really honors individuals we work with? And turning that inward and saying, and how are we doing that internally? How are we ensuring that we have processes, procedures that are meeting the mark for us? So we have really great data, so we can learn from that, so we can do the things with it that we want to do. We can make all these learnings. And so let's think, I want to lift up kind of 3 considerations for all nonprofits that we've learned in this case study and things that are very much top of mind for Prevent Blindness, which I think makes them just a model for this for other organizations. And that is what happens when we have duplicate data, we have inaccurate data, we have inconsistent data. Like it happens to everyone. We're all in that same boat. It is more common than you think. And a lot of times there's errors in it. And so, how are we checking for human error? It really starts with the people. It could be who you're collecting it from, or it could be how you're entering it. And so, thinking that through and really spending time to check the errors and make that a part of your natural process. Develop internal controls, internal protocols for you to find and spot those easily. You know, I always love an outlier check, like we have an adult program, yet we have a 2-year-old enrolled in it. Tell me how that happens, right? That's a flip of a date. That's the year entered wrong. It happens to the best of us. And so finding ways that you have those check-ins, those internal controls that help you spot the common errors that you have. The other thing we really need to be mindful of, and I always think about it, is be kind to your future self. But I'm here today. I know exactly how we do certain processes at United Way. Monica knows all the ins and outs of all the work happening to prevent blindness. And when we both win the lottery and go off and become like major donors to our organizations and many others in the room, who's going to know how we did what we were doing? Who's going to know our rhyme and reason of why we did that way? And so standardize your process to reduce the risk of error is something that, yes, we want to document our procedures, but like carve in that standardization so you have that there as a way to reduce and mitigate the even potential for error. That's going to help with inaccuracies, prevent inconsistencies. I love like developing rules of the road as a way that we are all on the same page. We're all speaking the same language when it comes up. So that way you have that just as a part of your team, as a part of your culture. I know I'm like a very big stickler on it's four-digit year. So it's 2026. It's not just 26 when we're entering data. Like what's the rule of the road so we have some consistency in how we do things? If we don't have that automated, right? I'm trying to think of ways that are, yes, automate, yes, pre-populate things for yourself. But you know, sometimes we just have to do it ourselves. We have to enter it ourselves. We don't have all those resources. The other one and the last one, and oh gosh, Monica, there are sometimes people say stuff and I'm like, I want that on a t-shirt. And it's this notion of training regularly on these documentation, on these standardizations. That way you're again being kind to your future selves. Like we often like, yep, a new hire, we need to train them. Yep, a staff, let's cross-train staff. But thinking of that more than just a one and done training experience, how are we retraining? And it was this like as you evolve, so does your data evolve. So does your standards, procedures for that. And so how are you keeping everyone abreast and fresh of that? So training regularly on your documentation procedures and putting that in a way that's like constant top of mind. So folks are able to reduce errors, find the common things that are coming up, and then just, address them as you go. So then you have this really like quality, rich data that you're able to learn from. So those are our recommendations into nonprofits from what we've learned and experienced in this case study. And I want us to pivot in now into the question and answer. So I'm gonna toss a question first to prevent blindness, but as I put that, please fill the chat up with any questions you have. Would love to hear from different audience members as well. But my first question goes to prevent blindness. And Heather, I was so excited to see you started with your theory of change. Number one, a lot of organizations are always like, can I see somebody else's theory of change? And now I can be like, let me direct you to the Prevent Blindness case study where you can see their theory of change and hear their CEO explain it. And so that was very top of mind for me as I was thinking about the case study findings and the distance. And it was this analysis, as Dan mentioned at the beginning, was really heavy on distance traveled. And so when it comes to accessing services, providers, partners, like you really hit that at the top, like how do you think about coverage and reach? I mean, you'll have a small team, you cover the whole state of Texas. How are y'all thinking about that? And then how is this data going to help inform, refine your approach? If you can share a little about that.
Yeah. So when I think about coverage, I think, we have an incredible volunteer team, right? I mean, we have hundreds of volunteers across the state. And so I think continuing to build that component is important for us. What struck me the most about the distance piece, right, was really there are so many providers. There are definitely places, I think, in the state where there are no providers, and we are very aware of that. So I think that is, for the team, we have to really think through, okay, how do we close that gap? But there are a ton of providers that are in where our clients are. And so I think for us, we need to assess, do we have relationships with them? And if not, right, start to build relationships with those providers. So I think really being able to say, okay, if there's no provider within 2 miles, what does the 5-mile radius look like? And if there are no providers within 5, and that, I mean, we know this is one of the issues, right? I think across the board, not just for us, just, in health, there are definitely pockets of the state that people are traveling 50, 80, 100 miles because that truly is where the one optometrist is. And we know that's an issue. So how do we maybe work with teams to incorporate more telehealth? So I think there are things, those types of strategies that we need to talk about. But I think, it's all really helpful for us as we think about, okay, there will be a team that works on building relationships. There's a team that will really look at, okay, if there's provider deserts, how do we close that gap? And we have amazing, amazing providers on our board. We actually have one that's on this presentation. Really, I think this is where it gets kind of exciting, right? You can think about innovative ways. How do we close those gaps? And brainstorm with them. Let's try new things. And I think that's really something for us, utilizing the data to really help brainstorm around innovative solutions is what I think is so incredibly helpful.
Yeah, love that. Thank you so much for sharing that, Heather. I too was like, it's like the different mile groupings in this, like the 2 mile, the 5 mile, the 10 mile, the 20 plus mile. I think during one of our check-ins, I was like, how far is it to my eye doctor? Like, what do I travel? I travel 7 miles. So to see that 10%, like 52% travel less than 10 miles, I was like, oh, I'm in that group. So I think it's just interesting, right? And in the huge metroplex of Greater Houston, right? Harris County. So I think that mileage too makes a lot of sense, and like how you're thinking about it and how like we have a lot of services across the area. And so how are people thinking about it? And in spaces where you have gaps, what is there context to that, right? Like it's not just this set, like we want everybody to have access within 2 miles, which would be great and wonderful. And yes, but also like you have advocacy, this hub concept y'all were talking about too. So I can see how all your pillars kind of really fit into that. So really love that. I'm seeing a question from Betsy in the chat. And so the question comes up of, are there any additional barriers beyond distance that your clients face? Transportation, that's one she gave an example of how do you connect them?
And I'll let, go ahead, Monica, jump in. Yes,
All
the
right.
answer is yes. There are definitely more barriers.
Yeah, there is several. Aside from distance, transportation is a big one, especially for patients who are in rural areas. Or maybe it's the patient who doesn't have, it's the senior patient who doesn't have a caregiver to take them, or maybe an adult child to be able to take them to and from their doctor's appointment. There's also a huge barrier of just lack of knowledge. We receive or we serve a large population where we are the first entry into any kind of eye screening or eye care that they have ever received. And so, part of our screening process is not just screening for risk and for acuity, whether it's distance or near, but it's also having that conversation with them. And that's what we call our exit interview. And this gives us the opportunity to be able to talk to the client, maybe answer any questions they have. Maybe it's, them not having any kind of resource. And this is where we help to provide that follow-up piece or that follow-up component to help close the loop. But yeah, lack of knowledge is a big one. And then insurance and costs. And even though people may have insurance, it may not cover all the vision care, eye care needs that's required. And so, whenever we provide the resource, we also do a lot of care coordination and a lot of follow-up steps. If the doctor comes back and says, hey, I think this person may have issues because of their diabetes. And so we're helping to try to find and navigate the client to the best resource possible for them to be able to continue receiving any kind of additional eye care they may need. Um, and then just to kind of add on to Heather's point too about distance, for whenever we're seeking our partnerships, for us, it's not about providing a one-time service, but we want to make sure that people, learn about eye health and why change behavior for eye health is so important, because we want to make sure that they just not have the service for that year, but also the following year and the year after that, because chances are they're probably going to need an eye exam. They're going to need a pair of glasses. In Texas, your prescription is good for a year. So it's not uncommon for us to get repeat clients. And for us to say, hey, you helped me out last year. I still need help. How can you help me out? And so that's a very common question, and another very common theme that we have for a lot of the clients that apply through our services. But yeah, definitely barriers, costs, lack of insurance. Maybe it's that working, what we consider to be the working poor client, where they don't necessarily qualify for a coverage. And so this is where we're also helping to fill that gap.
Thank you, Heather. Thank you, Monica.
Let
Heather,
me,
you're going to add something?
I was going to add one more thing, because you asked how do we connect them. One of our pieces of strategy is really looking at where the client's already going for service, right? And can we bring that to where they already are to help reduce some of those barriers? And so really looking at kind of community hubs, community health clinics. We even just had a conversation about university clinics, health clinics, and building partnerships. So really strategizing about where are the clients going already to get some kind of service. And because most clinics, most resources, they don't have vision available. And so bringing our service where they already are is one of the ways we've tried to mitigate or reduce those barriers.
Thank you. Thank you so much for that, Heather. I want to stay on this line and then we'll come back into the question coming in from the chat. But I want to toss it to Dan and the team from Kinder Institute, because I think I'm like hearing this distance, how they're using this information, kind of the spread across their serving, and that research question one of what's the average distance clients travel for a screening. You have screener data, you have zip code data. I live and breathe and die by zip code data. And so it seems like some spots people are traveling more. Can you unpack that for us? What does that mean?
Yeah, so with regards to unpacking the distance piece, one of the things we really did want to try to lift forward were, and it's always this is building off what we just heard from Heather, which is like looking where clients are already going. Are there spots, are there spaces where we see clients traveling more to get there? And so we wanted to kind of crunch those numbers for sort of all clients. And that's where, again, half the clients are traveling less than 10 miles, which is a super big success. We can sort of flip that and go, there's also about 3 in 10 clients who are having to travel over 20 miles to make their journey to that screening location. And so then from there, we wanted to zoom in and go, well, what were the particular agencies where we saw a lot of travel distance? And then to build on that, are there zip codes potentially where there are people that are traveling lots of distances to get to this service that PPT is providing? And again, all of it in that spirit of if I know where folks are already going to get services, can we begin to add and to direct services in those ways to help maybe ease some of that burden that folks are facing when it comes to getting that service. And then, from there, recognizing that beyond the screener, where do we go and get that service? We've talked internally with between PPT, United Way, and Kinder about like the data we were using was optometrist data, but PPT works with a lot of clients that don't need an optometrist, they need an ophthalmologist. And now we're nerding out big time, but the point simply being of, we were looking at one dimension of the service providers that clients were potentially after. And it just sort of, again, speaks to the degree to which there are places that resources can be targeted to sort of double up on successes that people are having, the availability of service providers. How do we partner in those spaces? And then there's that second piece of the puzzle that's like, where are we finding people with this need, traveling big distances? How do we try to cut some of that down? Potentially. Again, I guess this is that moment where like the data offers some guidance, and this is where PPT has that opportunity to figure out like what might next steps look like there.
Yeah, I love that. Let's bring data into action. That's what I heard. Um, I want to keep going on there though, Dan, because that's the question coming into the chat too. And I think you spoke a little bit about it, but this one's from Alicia about, did you look at those who traveled further but did not go to the nearest provider?
Yeah, so I guess a little clarification on and I really am not trying to play semantics here, but I want to distinguish between the provider and the partner agency or the
Yeah.
screener location.
Mm.
So when we were calculating distances to screener location, we were looking for where they went. We were not necessarily looking for where the closest one was. And for some of the locations that we were looking at, we did notice that there were folks that were oftentimes traveling seemingly more distance to get to the screener location that they were going to than what might have been the closest screener location that was available. Um, could be tons of reasons that are behind that type of thing. Again, there's a preference piece of it. There might be a connection or a relationship with a nonprofit or a community health clinic that they feel more comfortable being a part of, and so I'll travel that extra distance to get there. But we for sure noticed some of that, but it is not necessarily something that we attempted to unpack within the analysis. The provider piece is kind of a completely different story because there we weren't really looking for where were they going. We were rather trying to understand what's available. So the provider question is a much more what's available near where clients are at as opposed to where are clients going explicitly.
Yeah. I love that. I think you do have to get into semantics on it. I think that helps it be really clear and really specific in your programming and your work. And like, is it screener? Is it provider? Is it partner? What are we looking at? Like, who are we strategically, I'm going to ask Heather a question about this because this has my gears turning about programming and like, how are we using this data to improve our efforts and to improve our work? Because like, how does it show up in your day-to-day work? And what you're talking about there, Dan, from like screener, provider, and partner, you're like, yeah, let's set goals, let's set objectives of who we're going to try to cultivate relationships with. Our time is not infinite. And so how do we really target our efforts there? But then also like take the step back, like the big goals you have coming up for your organization, Heather, like just curious on how these insights are going to help drive like fundraising operations, day-to-day program planning. If you can just share some glimpses of that for us. Yeah.
Well, I think, when we met, one of the big takeaways was I think from a fundraising perspective, and just from a development, a brand awareness, right? Really looking at these providers that we don't have relationships with. And I think starting there. I think the other component is, you know, for those clients that are traveling, 60, 70, 80 miles to a partner location to get screened, I think, it's a great opportunity for the program team to really look at, are there other potential partners that are closer to those zip codes now that we know, right? Can we build those partners? Can we, reach out to them? So I think from a strategy standpoint, the provider component is really building on the development brand awareness. And then obviously, being able to partner with them to provide services. But from the partner perspective, I think looking at some of those places where they are traveling long distances, and do we need to find other partners that are in the space that could be closer? So I think immediately those two pieces come up. When I think about the hub component and advocacy rate, I think really looking at, again, going back to the providers and building that relationship and soliciting feedback and having their buy-in around what's important and, insight around advocacy. How do we partner around that? And so from a relationship perspective, I think we take this data and really understand how do we then approach building the relationships, because I think those are fundamental for us moving forward in some of our larger components. And then going back to finding different partners, that builds to the collaboration and hub component, but also building our brand. And that's one of our big strategic focuses for the next 3 years too, is really having people understand who we are, what we do, and the value that we bring to the table. And so I think, having this information of we have a place to start in, contacting providers and building those relationships and potential partners.
Well, thank you. Thank you for a glimpse into that in that day-to-day programming, fundraising, what that means for y'all as an organization. And yeah, let's stay in this distance space, because I want to talk a little bit more with the Kinder Institute team on this, because across your research questions, you had a couple of different approaches to considering access and reach. And so there was like the straight line distance that was like as the crow flies that Eric was explaining, and then the fixed radii that comes up with 2 mile, 5 mile, 10 mile, that kind of set groups. Both approaches are great, and like you can consider both of them. And nonprofits, when they're trying to like, how do I apply this because our resources are limited, like what should nonprofits consider when setting these kind of geographic boundaries, and how can data help guide those decisions in a meaningful way? If you can just share a little bit more, maybe this is a little more on semantics that help, but would just love y'all's insights on that.
Yeah, so for us, when we were going through and thinking about that calculation of as the crow flies, it's very true that if I hop in my car and try to drive from point A to point B, very rarely do I get to go a straight line as the crow flies. I'm oftentimes turning left, turning right, sometimes circling back, depending upon what the road is doing. And so ultimately, what our decision was trying to come back to was not that we were attempting to get like a very specific calculation of how if I get in my car, what is the Google Maps to blah blah blah, but rather it really was trying to gauge how far are clients from some sort of partner agency. And so with that sort of spirit guiding the question that we were attempting to answer, as the crow flies will let us know, is someone closer or further away from a partner agency that they could go get screened at. So that was sort of some of the logic and reasoning behind the as the crow flies. Shifting to talk about the kind of radius aspect of it, to some extent, I think there's a little bit of arbitrariness there, just to sort of be honest and upfront about this. I think in different city settings, 2, 5, and 10 miles can feel like everything or nothing. And Houston's one of those spaces where, because we're so spread out, 2 miles is really only capturing pockets of the area. Whereas if you go into more densely concentrated spaces, and Texas in general, pretty spread out, but just sort of acknowledging that those exact like distances are sometimes it's really about like what might make sense. But then again, one of the challenges we were grappling with here was we weren't just looking at Houston data or Dallas or Fort Worth or San Antonio data. This was trying to capture something to try to say something about, again, the state, which for anyone who has hopped in their car and driven around for 7 hours, you're still in the state, but you've also driven through some very urban areas, suburban areas, and some of the most rural spaces you're ever going to come to know. And so trying to think about what might make for a reasonable amount of distance for people with different resources, different access to their own private vehicle versus public transportation. Um, and in some ways make up distances that have some relevance across different contexts. And so a lot of that was the logic that was going into the 2, the 5, and the 10. Now, that was very much thinking about PBT and their programming across the state. And so, Jessica, I guess to sort of swing it back to like, if I'm a nonprofit, I got to think about that for myself. If my nonprofit is working with people that have mobility issues, sorry, not mobility, physical mobility, but mobility like transportation issues more so, then I need to recognize that if I'm setting my boundaries at 5 miles or 10 miles, I may very much be setting them at a space where clients aren't really going to be in a position to try to make that journey. And a lot of times it can be a journey. I was mapping stuff the other day, a 1.5 mile journey in my neighborhood is a 7 minute drive in the car and a 45-minute ride on public transportation. So, like, this mind-boggling inefficiency of Houston public transit there, which is a side conversation, I suppose, but just the point being of, without the presence of that personal vehicle, distances that maybe you and I could agree, it's 1.5 miles, it's a nothing, let's do this, becomes a very real something. And so, again, it's that kind of like customization of distances based on where a nonprofit is located and who their clients are and who they're trying to serve can help guide some of that decision making on distances.
Yeah. Thank you for that, Dan. Kevin in the chat's kind of going in with you on this one a little bit. Would time traveled be more relevant measure than miles?
Again, depending upon the data you have, time traveled is a powerful metric to be able to get a hold of. I'll just throw the additional wrinkle of what is my mode of travel? Am I walking? Am I biking? Am I driving in my own personal car? Am I doing public transportation? All of those are just things to consider. There's not a no in that response. It's simply a matter of if we've got that data, that can be a really important way for us to be thinking about. Because if I'm trying to make myself such that like a client could literally walk to me within 10 minutes, my radius shifts to potentially a 1/2 mile at that point. Awesome if that is what I'm trying to do. But again, just going back to that acknowledgement of figuring out what is it, who am I serving, what might be some of those barriers that they're facing, and how do I want to think about the geography of my clients can really drive some of that decision making there.
Really appreciate that. I think there's this, like, I always call it like grappling, like we're grappling with something. And it might be this like subjective conversation, like arbitrary could be the word we use. But for me, that's the transparency that we have in our decision making and why we chose this way to measure miles versus time traveled versus like whatever that might look like. I think it builds that consistency in your decision making. If we had that conversation, this is why we set on this, and then we're consistent with this is what we're looking at. And so that brings that meaningful intentionality into how you're thinking about your data and using your data. And so really appreciated that kind of lift up on that. Um, Here's another question coming in from the chat. Is there a correlation of income level and distance travel or services available? I don't think we went that deeply into those notions, those elements in this case study, but I think, Dan, anything you want to add there? Kinder, team, or Heather, Monica, anything like anecdotally y'all think about that?
Eric or Claire, I know we looked at a variety of variables. Do you recall if you all had looked at income relative to distances, Claire?
I believe that that was something that we were really thinking about. I think that honestly, that was one of the initial ideas for the research question. But I think that given the data that we had, it naturally came to this sort of we can only be really confident within the distance data because I think pulling from the income level, it's like we can only estimate so much because we don't have these exact incomes for all of the client data. But that's just sort of how I viewed the flow of data analysis, if anyone else wants to jump in.
Yeah. So Claire's touching on just like a couple great points there. One is income is typically collected as a range, and that's a normal way that income gets collected. There's missingness out the wazoo, and that's the nature of the beast when asking those types of questions of people. And I'll just sort of build on those two as well with the range of income, like the total range of incomes of clients served by PBT. We weren't looking at client data that was ranging from people earning less than $10,000 to people making more than $1 million. The range in incomes is really concentrated towards that 50K or less space. And that is not to say that there aren't important distinctions to draw there in many ways. At the end of the day, we really are talking about a collection of clients that are being served that are on that lower end of the income spectrum. And so I think ultimately there was the sort of like missing data, the range of values we were working with, as well as sort of that concentration on the lower end led us to say, hey, while there might be some statistically significant differences, the substantively significant meaning behind it, non-existent. And so ultimately the decision was to keep it at that overall level there.
Thank you. Thank you for that, Claire and Dan. Heather, Monica, anything kind of coming up for y'all as y'all think of this conversation about income level, distance traveled, the time versus miles? Anything for y'all that you want to add?
I mean, for me, when I think about distance traveled, I really think a majority of like when I looked at some of those, some of the cities like in Laredo, I mean, there basically is, you're talking about West Texas, and we do a clinic, once a year, and people come from all different areas around in West Texas because there are no, you know, providers in that area, very few partners. And so I think if I, looking at it just kind of off the cuff, I would say more than anything, it is probably where they are located. Because we do serve the whole state. I mean, we serve a lot of rural areas. We have partners in the hill country, we have partners in the valley, in the Permian Basin, right? Lubbock, Laredo. So there, I mean, really across the states, I really think a majority of it is. Um, and we do. I mean, for our clients that receive services and financial support, the majority of them are 200% below the poverty line. And so I think really it comes more down to the area that they are in, just because of lack of either, partners that we could partner with to provide the service, or providers aren't in that area. Because for us, one of the things we do look at is if we are going to screen, there has to be at least a reasonable next step to move them to, right? In the sense of where they can get care. And so we look at that too. And so again, depending on where you're in the state, reasonable could be defined as 10 miles or 80 miles, right? So I think a lot of it has to do where they're located, given that we serve, all different types of communities across the state.
Yeah, no, thank you for sharing that. I appreciate kind of both contexts coming into that because we all kind of think about distance traveled for our services. I think of what that means for y'all, and people are like miles traveled. I love Dan's notion of like within a 10-minute walk. I think of some of like our youth development programs on. I see Boys and Girls Club, right? Like, what's the distance the kiddo walks to your club? Like, is that something we consider? So bringing that context into your organization, and what does that mean? And so that I want to stay here for a minute and talk about that. Just another like question to Kinder Institute around like suggestions, consideration, because we all have address data, we all have zip code data. Like when we're thinking of that, especially in this geo data kind of space, what should folks be considering, or suggestions you might have?
So I think I want to start by circling back to something that Claire mentioned during the presentation, which is like we were able to geocode over 90% of PBT's client addresses. That is wild. It is wonderful. It is incredible. And it is clearly indicative of an organization that is making an investment in capturing that data. I'm going to also say, like, that means there were 10% we could not. And again, we only can geocode the 90 because of how good the data is. And so I start here by simply wanting to, again, acknowledge the quality of that data received, the clear investment that PPT has made in getting that data point, and that despite that effort, it's going to be imperfect. There are going to be addresses that folks are going to collect that either a name, a street name is misspelled, a zip code is completely flubbed on. And some of this stuff, if you get into the geocoding space, so we utilized a software known as ArcGIS to do most of our geocoding work. This is not a free software. There are some monies associated with it. But I also think that, Jessica, and you correct me if I'm wrong, it's our understanding that there are relatively affordable pricing rates for this software for nonprofits, for example. And so, not a plug, I'm not promoting. I think I'm just acknowledging that I wouldn't want to come in here and be like, yeah, we use this software. Good luck, everybody. So it was the software we were using, and that software does a good job of looking to do probabilistic matching. Hey, we think this address is probably attached to here. Or, I mean, like the classic example I give is if the address is 123 Main Street, but 123 Main Street does not exist, it won't say, oh, well, can't do anything. It might put it on the corner of 100 Main Street. And so it's going through the process of working with the data that are collected to get them placed on a map. It's just not ever going to be a perfect process. And so as you're collecting those data, making that investment. So again, the vast, vast, vast majority of your addresses will geocode immediately when you're going to try to do some of that work is definitely worth it. But then after the fact, there's going to be an iterative process. And Claire, Claire and Eric were both working on this. If you don't mind, if I put you two on the spot again, like, could you all talk a little bit about like what that iterative looks like in terms of, we made our first pass, not all of them matched. What were we doing at that point to try to get additional addresses geocoded?
I can answer, I guess, like on my part. So you have the initial pass and then you have to rematch all the addresses. So for me, it was a lot of cross-referencing. We have the original locator file, which is kind of our source of truth. And then just looking up the addresses online was honestly like a lot of cross-referencing between Google Maps and just seeing where that was and then going to the original locator file and seeing what the point is named within the locator file because again, like as Dan mentioned, there's a lot of things that change. The locator files aren't frequently updated because that's just not feasibly possible. So, for example, there might be new developments or streets get renamed and things like that that don't actually get reflected within the original locator file. So, after that, just putting the point in the locator file and assigning that to the original data value was what was really helpful for me.
Yeah, I think my process was definitely very similar to that. So my first thing was always to try to see if the address itself could be recovered. So sometimes we'd go and see it didn't match, and I'd go to the address and notice there was some typo. And so you'd go fix the typo and then it'd match. And so that's was my first passage, was trying to fix the addresses, get it to something where it could reasonably match just based off of the address. And then there were cases where it seemed like the address didn't even exist or there wasn't even an address provided, things like that. And that's where, for me, I'd go to the name of the partner agency I was trying to locate, and I'd Google that partner agency and then look on Google Maps and see if I can find that agency specifically in an address or location they provide. And then I'd cross-check that and see, is that in the same city that the data file says it is? Would it make sense for the clients to be traveling there?
Yeah, and so again, sort of this mixture of when we're working with client data, doing our best, as Eric was talking about, recovering them, fixing them if we saw misspellings. When we were looking with partner agencies, working with the optometry data, there was the opportunity for us to go and utilize other resources that were out there to say, hey, Dr. Dan's eye place. I'm just gonna, it's my new eye office I just opened here. But if we're looking for Dr. Dan, I might not have my address listed in the file we had. You can Google Dr. Dan's eye place, and oh, ta-da, here it is, 123 Main Street, and we can get that added in. So, variety of different options, a variety of different mechanisms used to try to get those addresses geocoded. A big shout out to Eric and a big shout out to Claire. They were doing a lot of the heavy lifting with that iterative process on the data cleaning, and getting the numbers as high as they were gotten for purposes of the geocoding. I just also want to finish where I started, which is as good as the data might be, as perfect as you have been putting in that effort and energy, geocoding is an imperfect process, and so becoming okay with, I want to get a bunch of them. I want to get a lot of them. I'm unlikely to get all of them geocoded.
Thank you. Thank you for that kind of considerations, suggestions, just rules of thumbs. I know I will be sharing this recording with folks when we start talking about geocoding data and they have these kind of questions. I think y'all all really helped explain that. So thank you so much, Claire, Eric, Dan. Want to give another call for any questions, any last call for questions for the Q&A. Please drop them in the chat. But Heather, oh, yeah, Heather, I want to circle back to you because I also think this case study too, you started with a theory of change. We knew coming into this case study experience, y'all had your strategic plan effort underway. There was all of that. And so if you can and you spoke a little bit about it, about building your brand as a part of your strategic plan efforts coming up. And I think this can just be such great motivation for other organizations as they're kind of going into their strategic planning process or coming out of it as well. So if you can just share a little bit with us about insights from this case study that's going to help bring your strategic plan to life and continue to inform your work.
Yeah, so we had kind of three pieces around our strategic plan. We worked with Breaking Bounds to do our market analysis and provided, again, data. And I think that is one of my, key takeaway too, or what I would say is super important, is we really have invested in all different ways to get data to really drive our decision making and planning. So they did a really strong market analysis for us and looked at all different things. 4 or 5 things bubbled up that were basically helping us really think about how to do the work, what the market said was needed, compared to what we were doing. Then we went through, started to build our theory of change. I shared with you, we put our strategic plan into a logic model. So we look at all the components of the logic model and start to fill them in. And so for me, the takeaways from the data here, I do go back to, the number of partners, and keep in mind, this is just on the adult side. So we serve children too. It was really just kind of blew me away. We work with our partners every day. I mean, Monica and her team, talk to different partners across the street every day, but it was 146 is pretty good. And, the amount of zip codes. And so just really, I think, one, taking a step back to really think about, okay, we really do have a strong reach. How do we build on that to get us further to where we want to be, right? And this idea around, building this hub. We also had a partner meeting in Houston in September and got their feedback too. And this whole idea of building cohesive connections to streamline the journey for the client keeps coming up from everywhere, from our partners, from the market experts, right, from our own team. And so this data, I think, will really help us, again, strategize where we start to make some of that happen, to build this more effective journey, more effective systems for our clients, and to help our partners, right? To make it easier on our partners too. But to me, it's just all these different pieces, including this data, just really drive home how important a streamlined approach is, a collaborative approach is. And I think this data gives us one more inflection point of where do we start to build these relationships if we don't have them.
Wonderful. Thank you. Thank you for a glimpse into that insight. And thank you again to Prevent Blindness for joining this case study experience. It's a little club that we have of organizations that have engaged in the case study. And we're just always so grateful for Kinder Institute and their partnership and their really mindset and partnership. And this is happening with us and not to us, very co-design, co-create. So thank you again. Round of applause to both teams, to both organizations. Thank you all. I want to just do a shameless plug. Please offer your feedback. It's a gift. We really want to make sure these presentation share outs are hitting the mark. Please join us again next week for our first quarterly virtual session of the year, the first traditional one. It is February 5th from 9 to 10:30 a.m. via Zoom. The very wonderful Allison Mattingly will be leading us through Data is for Everyone and highlighting two amazing organizations, DeCamera and DePelchin Children's Center, and how they're using data across their organization, but the people using it. And so can't wait to hear more from them next week. Hopefully that's a great spoiler for that and you're all registered. Again, thank you all so much. Really appreciate your efforts here. I know so much learning for other nonprofits will come from this case study. So thank you, and we hope to see you soon.